While eggs are rich in nutrients, consuming too many can have several negative health effects, especially for people with certain medical conditions. Cholesterol and heart problems. Eggs, particularly the yolk, contain high levels of cholesterol. While dietary cholesterol doesn't directly raise blood cholesterol in everyone, excessive intake, especially when combined with a diet high in other saturated fats, like sausage, bacon, or fast food, can increase the levels of bad cholesterol, LDL. This condition can raise the risk of heart and cardiovascular diseases. Increased risk of diabetes. Some studies suggest a link between excessive egg consumption and an increased risk of type 2 diabetes. This is thought to be related to the natural fat content in eggs, which may trigger insulin resistance, a condition where the body's cells no longer respond to insulin, causing blood sugar to build up instead of being used for energy. Digestive issues. For some people, particularly those with sensitivities or allergies, eating too many eggs can cause digestive problems like bloating, gas, or diarrhea. Egg allergies can also trigger other symptoms such as rashes, itching, or shortness of breath. Weight gain. Eggs are relatively high in calories and fat. Consuming a large number of eggs every day without sufficient physical activity can lead to a buildup of calories and fat, which ultimately contributes to weight gain and even obesity. Hormonal imbalance and acne. Excessive consumption of non-organic eggs has also been linked to hormonal imbalances, especially in women. These eggs sometimes contain artificial hormones given to poultry. Additionally, eggs can trigger inflammation in the body, which increases oil gland production and may contribute to acne breakouts. Recommended consumption limits. There is no single limit that applies to everyone, as each individual has different health conditions. However, many nutritionists and health organizations suggest a safe limit for egg consumption. Generally, for healthy individuals, eating 1 to 2 eggs per day, or around 6 to 7 eggs per week, is considered safe and beneficial. If you have a history of high cholesterol, heart disease, or diabetes, it's best to consult with a doctor or a nutritionist to determine the appropriate amount of eggs for your specific health needs. While moderate coffee consumption is safe for most people, drinking too much can lead to a variety of negative health impacts. The amount that is too much can vary significantly from person to person, depending on factors like genetics, body weight, and individual sensitivity. However, a daily intake of over 400 milligrams, about 4 cups of brewed coffee, is often cited as a point where negative side effects become more likely. Here are some of the negative impacts of excessive coffee consumption. 1. Jitters and anxiety. Caffeine is a stimulant that can increase alertness and energy. However, at high doses, it can lead to nervousness, jitters, and a feeling of restlessness. For some people, this can trigger anxiety or even panic attacks. This is because caffeine blocks a brain chemical called adenosine, which makes you feel tired, while at the same time triggering the release of adrenaline, the fight-or-flight hormone. 2. Sleep disruption. Caffeine's primary function is to keep you awake. Consuming too much, especially in the afternoon or evening, can significantly interfere with your sleep cycle. It can increase the time it takes to fall asleep, reduce the total amount of sleep you get, and decrease the quality of your sleep. 3. Digestive problems. Caffeine can stimulate the production of stomach acid, which can lead to indigestion, heartburn, and stomach upset. It can also act as a laxative, causing diarrhea in some individuals. This is particularly problematic for people with pre-existing conditions like GERD, gastroesophageal reflux disease, or irritable bowel syndrome, IBS. 4. Increased heart rate and blood pressure. For some people, particularly those with a sensitivity to caffeine or pre-existing heart conditions, excessive consumption can cause an increase in heart rate and blood pressure. This can manifest as heart palpitations or a racing heartbeat. While this is usually harmless in healthy individuals, it can be a concern for those with a history of heart issues. 5. Caffeine dependence and withdrawal. Regular, high-dose caffeine consumption can lead to physical and psychological dependence. If you suddenly stop, you may experience withdrawal symptoms such as headaches, fatigue, irritability, and difficulty concentrating. These symptoms are a sign that your body has become reliant on caffeine to function normally. 6. Other potential effects. Dehydration. Caffeine has a mild diuretic effect, which can increase urination. While this effect is small, and the fluid from coffee still contributes to your overall hydration, it's a good practice to also drink water. Bone density. Some studies suggest that very high, long-term caffeine intake may be linked to a small decrease in bone density. especially in women who don't consume enough calcium. Worsening of pre-existing conditions. Caffeine can worsen symptoms of certain conditions like anxiety disorders, migraines, and urinary incontinence. While sea fish is a healthy source of nutrients like omega-3 fatty acids and lean protein, consuming too much of it can have negative health impacts due to the accumulation of certain contaminants and other factors. Here are some of the negative impacts of eating too much sea fish. 1. Mercury poisoning. This is one of the most significant risks associated with excessive fish consumption. Mercury, a neurotoxin, can build up in the bodies of fish, especially larger predatory species like shark, swordfish, king mackerel, and some types of tuna. High levels of mercury can damage the brain and nervous system, and symptoms can include memory loss and difficulty concentrating, mood disorders like depression and anxiety, tremors, numbness, and muscle weakness, impaired vision, hearing, and coordination. Fetuses, infants, and young children are particularly vulnerable to mercury's effects because their nervous systems are still developing. 2. Polychlorinated biphenyls, PCBs, and other contaminants. PCBs are industrial chemicals that were banned decades ago but still persist in the environment. They accumulate in the fatty tissues of fish and can lead to a variety of health problems, including damage to the immune, nervous, and endocrine systems, potential for cancer and reproductive issues, developmental delays in children, skin lesions, and liver disorders. Other contaminants like dioxins and certain pesticides can also be present in fish, posing additional health risks. 3. Food poisoning and parasites. Improperly handled, stored, or undercooked fish can be a source of foodborne illnesses. This is a particular risk with raw fish, e.g., sushi and sashimi. Contamination can come from bacteria such as Salmonella, Vibrio, and Listeria, which can cause symptoms like diarrhea, nausea, vomiting, and fever. Parasites, like tapeworms and other organisms that can lead to gastrointestinal distress and other long-term health issues if left untreated. 4. Overconsumption of omega-3 fatty acids. While omega-3s are generally beneficial, extremely high levels from a diet rich in fish can have a blood-thinning effect. This can increase the risk of bleeding, especially for individuals on blood-thinning medications. 5. Allergic reactions. Fish is one of the most common food allergens. For sensitive individuals, eating even a small amount can trigger an allergic reaction, with symptoms ranging from skin rashes and swelling to life-threatening anaphylaxis. Recommendations for safe consumption. To minimize these risks while still enjoying the nutritional benefits of fish, it's recommended to vary your fish intake. Don't eat the same type of fish every day. Choose low-mercury fish. Opt for fish that are lower on the food chain, such as salmon, shrimp, canned light tuna, pollock, and catfish. Limit high-mercury fish. The FDA and EPA advise limiting or avoiding consumption of high-mercury species, particularly for pregnant women, young children, and those who are breastfeeding. Prepare fish safely. Cook fish thoroughly to kill any potential bacteria or parasites. If consuming raw fish, ensure it has been properly frozen and handled by a reputable source. Trim and cook fatty areas. For fish from known contaminated waters, trimming away fatty portions and grilling or baking can help reduce exposure to certain contaminants like PCBs.